There are 3 steps to fight against COVID-19 infections. First, to avoid an infection. Second, to improve lung functions, which are the first protective shield against infections. Through improving the pulmonary epithelia, especially by keeping the pH value of the surfactant at 5. This first protective shield can stop low concentration of COVID-19 virus invasion of the body. Third, by strengthening the immune system to fight optimally against the infection. CDT works on all 3 infection treatments, but especially on the improvement of the first protective shield, the lung epithelia. It will be shown that CDT can improve stroke, spinal cord injury, cerebral palsy, cancer, cardiovascular performance, and other diseases through repairing and improving the central nervous system functioning. The stroke patient relearned to play violin again.
And still later on, Jan Berkey was able to play violin on his own again.
The spinal cord injury patient Nepheli relearned walking and running and became continent again. The cerebral palsy girl Sophie learned walking, became fully continent, and the cognitive functions improved. The brain cancer patient Hans relearned after the cancer removal to walk, run, and cycle again. Since the nervous system is involved in nearly all body functions, including the lung, a nervous system training, CDT, can improve lung functions to improve the first protection shield against infections and can repair lung functioning in the infected case. When exercising coordinated arm, leg and trunk movements on a special CDT device in the lying position, the breathing is enhanced and the ciliated epithelia will transport infected mucus and foramen particles to the pharynx, where it is couched up by the patient. Because simultaneously, the cardiovascular performance is improved in the short-term memory, the risk of a thrombosis and heart attack caused by the infection is reduced. Also, other disease, which elderly may have, will be treated simultaneously. The performed movements in CDT are creeping,
schneller, rhythmisch,
crawling, upriding,
down, up,
skywalking, walking on treadmill and freely walking, running,
backwards, lift the knees,
jumping, exercising on the special CDT device in the lying, sitting and standing position. Other movements. Coordination dynamics therapy to repair the human CNS will be started with stroke patient
Suffered a
Schalow.
stroke with right-sided hemiparesis. He could no more move his right arm and right hand and thus was unable to play violin anymore. During his first charity event after the stroke, the patient was holding the violin on his healthy side and his son guided the bow in coordination. The patient's right arm was hanging down and showed spasticity. To recover, Jan Berkey trained to walk and to move his right arm. Sometime later, he started coordination dynamic therapy. During his second charity event after the stroke, he already could slightly move his paretic arm.
At an age of 5.5 years, Nephili became cancer. With the removal of the cancer, Nephili suffered an incomplete spinal cord injury at Th10-11 levels by medical malpractice. At an age of 9.5 years, coordination dynamics therapy was started for 4 years. Following 1 year of CDT, she became able to manage better at school. Her continence improved and she became able to walk to the whiteboard. Spasticity and bowel pain reduced. No cancer recurrence so far. Her balance and trunk stability improved. To further improve trunk stability, hula hoop was trained.
Start.
She liked this hula hoop because she was the only one in the class who could do it, which improved her self-confidence. At the beginning, she managed a bit and later on she became good in hula hoop. The school teacher included her as much as possible in the sport. Sometimes Nephili trained also at the beach. For motivation, she was sometimes allowed to train with her
Go
Guinebics.
on, Nephili.
The training of balance and trunk stability made it possible that Nephili learned a bit, first time in her life, to ride a bicycle, which is important for the mobility.
Now,
Nephili's running improved and a bit of jumping during running became
backwards.
possible.
Lift the knees.
At the beginning of CDT, CNS functioning improved strongly. Some regeneration of her spinal cord occurred, see reference 24, when she was younger than 10. With increasing age, the repair became more difficult. Therefore, CNS injuries and malformations must be treated when the children under 10. The cerebral palsy girl Sophie, with an atrophy of the cerebellum and bones, started CDT at an age of 5.5. The parents of Sophie met the parents of Nephili in a rehabilitation center, and when Nephili made real progress, also the parents of Sophie wanted progress for Sophie. At the beginning of CDT, Sophie was incontinent, had severe balance problems, could not stand, walk, or run, and had no protection automatisms. When falling, Sophie would injure herself, and therefore the parents were afraid to train with her the walking. The first substantial progress through CDT with Sophie was achieved when she learned the protection automatisms. When she trained to stand freely and walk a bit, she could protect herself when losing balance. The training of freely standing and walking became possible. With ongoing CDT, the balance of Sophie improved and the freely walking became possible. She became fully continent. Her cognitive functions improved. Often Sophie trained together with Nephili. Sometimes the training together with several children is helping for motivation, but not always. Sophie was most cooperative when training together with Nephili. She just copied Nephili's movements. Sophie's creeping, crawling, upriding, skywalking, and walking improved. She nearly learned a bit the running. At the beginning of therapy, one could see the typical cerebellum and bones damage during creeping and walking. Sophie was overstretching, A, and overswinging the legs, B, in comparison to Nephili during creeping. The 72-year-old male patient, Hans, suffered the malignant anaplastic oligodendroglioma, WHO grade 3, at the Wernicke-Langwich cortical area after an undetected hematoma on the other side. Coordination dynamics therapy was started after the removal of the brain cancer, the radiation and chemotherapy. At the beginning of therapy, the patient was disoriented, could not communicate through speech or writing, could not stay in certain movement patterns because of low pattern stability, and he also had hypertension. Through 4 months of CDT, the hypertension was cured. The patient had relearned walking, running and jumping, and he was able again to cycle 14 kilometers to the remote hospital. The aphasia had substantially improved. He had relearned to write and read a bit. No indication for cancer recurrence so far. Such an enormous progress was possible because of exercising integrative coordinated arm and leg movements on a special CDT device in coordination with instructions and self-instructions like 2, 3, 4. Also, jumping, walking, running, and other movements contributed to the repair. This progress in human neurotherapy became possible because of a new development of basic medical research, which started from scratch. By clarifying aspects of anatomy and developing a new basic electrophysiological recording technique suitable for use in humans, the simultaneous recording of single afferent and efferent nerve fiber extracellular action potentials with 2 pairs of wire electrodes from undissected sacral nerve roots became possible. This technique can be used for intraoperative diagnosis and research. Further developments in morphometry of nerve roots made it possible to simultaneously characterize nerve fiber groups by group conduction velocities and group nerve fiber diameters. Based on the classification scheme for human peripheral nerve fibers, it became possible to distinguish action potentials from identified afferent and efferent nerve fibers and analyze the firing patterns of motoneurons and skinned afferents, primary and secondary muscle spindle afferents, and urinary bladder afferents, and analyze parasympathetic and somatic functions of the human CNS for continence and movements. An insight into CNS functions can be obtained from studying simultaneous impulse patterns of single afferent and efferent fibers and the phase relations between them, following natural stimulation. Especially continence functions in humans can be analyzed ideally. With the discovery of 3 kinds of human premotor spinal oscillators, CNS functions can be investigated based on the behavior of these spinal oscillators. Because the spinal oscillators serve as a reference base for identifying neurons and neural network organizations. By replacing the wire electrodes by EMG surface electrodes, also electromyographic activity can be recorded with the same equipment. Single motor unit activity can be compared with single motoneuron firing patterns. These oscillators are characterized by their rhythm of firing, namely by the frequency of repeated firing, with impulse trains and the interspike intervals of the impulse train. Phase and frequency coordination among neuron firing is an organization principle of human central nervous system functioning and can easily be observed by surface EMG. Following injury, malformation or degeneration, this coordinated firing between neurons becomes impaired and has to be repaired through movement-based learning. Besides that, other parts of the brain have to take function over from the damaged ones by plasticity. Through exercising on the special CDT device, this phase and frequency coordination among neuron firing can efficiently be improved and repaired. The improvement of phase and frequency coordination substantially contributes to the repair in cerebrum and cerebellum injury, spinal cord injury, SCI, cerebral palsy, stroke, aging and cancer. Since CDT improves the functioning of every CNS, and the CNS is involved in nearly all body functions, the regulations of body functions improve, especially the cardiovascular performance, including the breathing. Through improving lung epithelia functions, when exercising on the special CDT device, also the pulmonary surfactant improves as the first protective shield against low concentration of COVID-19 virus invasion. Breathing clean air with a negative ionization will keep the pH value of the surfactant at 5. Macrophages can easily move about and inculcate particulates, viruses, and bacteria. Especially exercising on a special CDT device, hiking or jogging in the forest keeps the lung in a healthy condition. But when living in a city with polluted air and a wrong heating system in the living place, the lung functions become impaired and the pulmonary surfactant cannot protect so well anymore. Through inhaling air polluted with dust, dirt, viruses and bacteria or wrong ionization, the surfactant changes its pH value in direction of 6. The surfactant gets more rigid and cracky. Through these cracks, viruses and bacteria can penetrate the epithelia more easily and the immune cells cannot easily move about anymore and engulf or attack viruses and bacteria. The pulmonary surfactant, the first protective shield against infection, is lost. Viruses and bacteria can easily invade the body. Children, brought up in a healthy surrounding, will have a healthy lung and are not easily attacked by viruses and bacteria. On the other hand, when you are old and have a high medical age caused by several other diseases which impair immune system functions, you may die, or if you are religious, you rise to heaven. Keeping people at home in unhealthy air by COVID-19 regulations reduces the power of the lung protective shield and makes the people less resistant against lung infections. From the point of view of this human research project, the treatment of infected patients in hospitals is wrong. The patients should not just lie in bed like dead. They have to be urged to move. They would need CDT for an improved survival. The exercising on a special CDT device will activate the nervous system rather integrative and coordinately and will improve lung functioning. When patients are too weak from infections and other diseases, their exercising has to be supported, as the author is doing it with the cancer and spinal cord injury patient Nepheli. Through such exercising, the lung functions improve, if ventilated or not. The ciliated epithelia increase their activity and transport more particles, viruses and bacteria out of the lungs. Exercising in the lying position will enhance transport of infected mucus to the pharynx because the gravity is not counteracting the action of the cilia. Through additional rotating movements, all parts of the lung epithelia can be reached. Exercising on special CDT devices improves the self-healing systems of the body. Leaving infected patients just lying in bed is no real treatment and dangerous for the patient. However, what happened with mainstream medicine worldwide? A terrible lot of money is spent to avoid infections and waiting for a vaccine to be developed. Mainstream medicine does not tolerate to look for other treatments. It is well known that exercising helps in many diseases. Mainstream medicine is just waiting for the miracle vaccine. Probably many thousands of patients did not need to die if CDT would have been administered to them. If a vaccine becomes available, still some patients will die as in flu infections, because the effect of a vaccination of flu virus infected patients is only minimal. Further, the COVID-19 virus will also change through mutation. A vaccine will not solve all the problems. Other treatments also have to be tried. If COVID-19 infected patients are in the hospital, they should be exercised in the lying position on a special coordination dynamics therapy device to improve lung functions and the cardiovascular performance. Many patients die on cardiac problems and thrombosis, especially in the lung. In the final stage of living, even extracorporeal oxygenation is used, which is a tremendous effort with nearly no effect. But physicians are not trying health improvement through movements. CDT improves the cardiovascular performance and lung functions. The deficits in mainstream medicine induced a worldwide crisis through not accepting movement treatment and underestimating the pandemic in this way. The biased selection of information in mass media through not comparing COVID-19 with other infections lead to a restriction of basic human rights based on an out-of-date mainstream medicine, which does not want to use new qualified research to save life of patients.